Meet Alex. Like many of us, Alex has been feeling constantly thirsty, always reaching for another glass of water. But what if we told you that excessive thirst and frequent trips to the bathroom could be a sign of a rare condition called diabetes insipidus? What is diabetes insipidus? Diabetes insipidus or DI is a rare but treatable condition where your body produces too much urine and struggles to retain water properly. The result? Frequent urination and constant thirst. And while the name sounds similar to diabetes mellitus, the causes and treatments are quite different. Let's break it down. Your body relies on a hormone called antidiuretic hormone, or also known as ADH, to help regulate how much water your kidneys keep. In DI, something goes wrong with how ADH is produced or how your kidneys use it. There are different reasons for this. Sometimes your brain doesn't make enough ADH, other times your kidneys simply don't respond to it. There can also be genetic factors, hormonal imbalances, or even issues during pregnancies. For better understanding of different types of diabetes insipidus, Gab will further explain this to you.
Hi, I'm Gab, and I'm going to be showing you the 4 types of diabetes insipidus. There are 4 main types. First is central diabetes insipidus, where the brain isn't making enough ADH. This is the most common type of diabetes insipidus. Up next is nephrogenic diabetes insipidus, where your kidneys can't use ADH properly. It happens when your pituitary gland releases enough ADH, but your kidneys don't respond to it properly and can't retain water. Next is dipsogenic diabetes insipidus, caused by an issue with thirst regulation in the brain. It is an issue with your hypothalamus unrelated to ADH production. And last but not the least, we have gestational diabetes insipidus, which may happen during pregnancy due to hormone changes. Gestational diabetes insipidus usually goes away after the pregnancy is over. Now that we get to know the different types of diabetes insipidus, let's now meet Isabel. She will now talk about the symptoms and the impacts of DI on quality of life.
Well, to diagnose diabetes insipidus, doctors use tests like the water deprivation test, where they monitor your body's reaction to not drinking any types of fluid. If you continue to pass large amount of dilute urine, it may indicate DI. Doctors may also check ADH levels or do a blood test to rule out diabetes mellitus and use imaging tests like an MRI to look at the brain's pituitary gland. Treatment depends on the type of DI you have. For central diabetes insipidus, doctors often describe desmopressin, a medication that works like ADH. You can take it as a pill, nasal spray, or injection. With the proper treatment, most people with DI can manage their symptoms and live a healthy and active life. But it's important to stay on top of hydration and work with your healthcare team to adjust treatment as needed. Back to you, Janine.
And finally, let's debunk some common myths about diabetes insipidus. It's the same as diabetes mellitus. Not at all. DI is about water balance, not blood sugar levels. You can treat DI. With the right medications and lifestyle adjustments, DI can be managed effectively. Only adults get it. Children can also develop diabetes insipidus, so it's important to be aware of the symptoms at any age. If you're experiencing symptoms of excessive thirst and urination, it's important to seek medical help. Early diagnosis and treatment can help you live a full, healthy life.
So, how common is diabetes insipidus? The good news is that DI is a very rare condition, affecting about 1 in 25,000 people worldwide.
Is it common in the Philippines? While there are no specific statistics for DI in the Philippines, its rarity suggests that it's not something you'll encounter every day. But like anywhere, if you notice symptoms, it's important to talk to your healthcare provider.
Does it affect one gender more than the other? But the truth is, diabetes insipidus affects both males and females equally. It doesn't favor one gender over the other, and anyone can be impacted.
Fun fact! Did you know that the name diabetes insipidus comes from the Greek word diabetes, meaning to go through, referring to the frequent urination people with this condition experience. And the Latin word insipidus means tasteless because the urine is very dilute, unlike the high sugar levels seen in diabetes mellitus. The term for diabetes was coined for patients who pass off more fluid than they consume, therefore siphon. The urine was tested for sweetness. In the case of sweet urine, the condition was named diabetes mellitus, Latin for honey, and is the result of excess sugar in the urine and blood. In history, this would be determined by examining the color, sediment, odor, and even the taste of the urine.
Here's another cool fact. Did you know that animals can get diabetes insipidus too? In fact, dogs and cats are sometimes diagnosed with this type of condition, especially when there's an issue with their kidneys or their ability to produce ADH. However, diabetes insipidus is rare in dogs and cats, and as a result from deficiency of ADH or the lack of response to ADH, or it may be the secondary type to brain trauma. So if you ever notice your pet drinking a lot of water and frequently needing to go outside, well, it may be a sign to consult a vet.
Thanks for learning with us today. Stay hydrated, stay healthy, and remember, knowledge is the key to manage your health.